Hello, everyone. Welcome to the Health Series podcast. Today we are looking at the topic, American versus Nigerian Healthcare System, Part 4. There is a conference paper entitled, A Comparative Study of the Healthcare System of the United States of America and Nigeria. One of the subsections is devoted to the discussion of the Nigerian healthcare system. It is argued in the section that the healthcare system in Nigeria is influenced by multiple realities in the country. The socio-political context of Nigerian society ties the availability, quality, and affordability of healthcare services to the structure, functioning, and policy framework of the country. Consequently, the unique Nigerian situation, typified by its mixed public-private sector nature of healthcare provision, healthcare financing, and patient choice, either in favor of orthodox or traditional medical care, forms the concern of this section. The organization of healthcare delivery in Nigeria is predominantly in the hands of the private sector and joint private investigators who handle patients. Despite the patient's choice among the alternatives, the Nigerian government is statutorily under obligation to ensure the welfare of the common man and the protection of lives. To this extent, the Nigerian constitution places the responsibility for the health and welfare of the Nigerian people under the government. While the economy in Nigeria is ranked 16th in terms of the Commonwealth nations, 1.24 billion people outside Nigeria fall into absolute poverty in the world. The prevalent endemic diseases in Nigeria include Lassa fever in a region of the country, bird flu, cholera, meningitis in the northern part of the country, and malaria. Additionally, the national healthcare system for Nigeria is bedeviled with issues of inadequate physical facilities, personnel, financing, and international patronage. The undue and disproportionately overbearing attention to this sector, especially in terms of focus and goodwill, has further stunted the growth and slow takeoff of the healthcare system. The attitudes of medical doctors toward the clinical appearances of patients are relatively alarming and unfriendly. The mention of the long waiting hours at the various healthcare facilities conjures the image of the unfriendly attitudes of the healthcare providers. There are discrepancies in healthcare provisions between urban and rural areas, mainly because it is highly unprofitable to establish healthcare amenities in such areas. Corruption and inefficiencies in the system have also affected the system. In 1999, the public healthcare system of Nigeria was ranked 187th. A national HIV/AIDS plan of action was only developed between 1997 and 2000 and only commenced addressing prevention in the late 1990s. In 2003, the Global Fund made its first disbursement to Nigeria. The Nigeria Decentralization Group provides insight into some of the ways such funds are used, highlighting the absence of requirements for participatory approaches as a significant limitation of resource utilization. In his welcome address at the 50th General Assembly, the then Nigerian health minister outlined new activities in the healthcare sector. The health sector reforms focus on 1. Improving healthcare in quantifying healthcare, nutrition, drug production, and psychological issues, and 2. Strategic health development. The essence of these new activities is to ensure the maintenance of good health services, and the government has set a target for the situation. Welcome activities will include the establishment of health districts and at least health suppliers. A significant activity to be encouraged is contract consulting. Local health consultation will be contracted to provide services to the health districts. The coverage of the nearest health districts in the country will primarily be the emphasis. I hope you enjoyed the video. Would appreciate it if you'd like the video and subscribe to the channel so we can reach more listeners like yourself. Until next time, stay informed, stay healthy, and continue exploring the world of healthcare with us. I remain your host, Dr. Sunday Clement. Thanks for listening.